In the last session, Dr. Kin Chi talked about medication strategies for managing atrial fibrillation, and now we'd like to move on to talk about some lifestyle strategies. A person's lifestyle choices can have a huge impact on whether or not that person goes on to develop atrial fibrillation, and a person who is suffering atrial fibrillation can work on those risk factors and have a positive impact on their ability to reduce their burden of atrial fibrillation. Weight, healthy eating, physical activity, and alcohol are the main lifestyle risk factors I'm talking about. Healthy eating is important for heart health, and a healthy diet helps to manage and reduce the symptoms and frequency of atrial fibrillation. We encourage you to seek healthy eating advice from credible sources or consult with a dietitian to get personalized recommendations on healthy eating. Physical activity is really important to reduce your burden of atrial fibrillation. People who are sedentary have far more atrial fibrillation than people who are active. Maintaining moderate activity levels significantly reduces the burden of atrial fibrillation. The Australian guidelines recommend 30 minutes of physical activity every day. I would encourage you to find an activity you enjoy doing. It may simply be taking a walk for 30 minutes. Some people feel anxious about exercising with atrial fibrillation. I can assure you that it is very safe to exercise with atrial fibrillation. It may be harder than usual to do it, but work within your limits and see if you can do some activity. Alcohol can impact your atrial fibrillation, particularly chronic alcohol intake. People with an increased alcohol intake have far more atrial fibrillation. So guidelines suggest cutting back alcohol down to no more than 3 drinks a week is the optimum goal. In addition to the lifestyle changes that impact on atrial fibrillation, there are other medical conditions that also impact on atrial fibrillation. And if these medical conditions can be better managed, then so can your atrial fibrillation. These conditions are obesity, high blood pressure, diabetes, obstructive sleep apnea, and high cholesterol. Managing these conditions will reduce the burden of atrial fibrillation and have the double effect of reducing chronic disease from those other conditions as well. The good news with lifestyle risk factors are these are the things that you can do for yourself to reduce your burden of atrial fibrillation. In the next session, Dr. Thomas Walters will be talking about atrial fibrillation ablation procedures and other procedures for treating atrial fibrillation.